So the last step in our stepwise approach is really a long incision facelift. And this is for situations where people not only need elevation of the facial skin along the jawline, but substantial tightening in the neck. And with a long incision facelift, we almost always perform a platysmoplasty as well. So the platysmoplasty allows us to tighten the neck in the midline, and then all that extra skin that accumulates can be pulled posteriorly and trimmed. So the risk-reward trade-offs for long incision facelift are such that, the skin flap that we elevate is bigger, so there's going to be more swelling and more bruising. The risk of hematoma is probably larger again because more skin is elevated. This is what's going to increase the risks of this procedure in comparison to, say, an S-lift or a short scar lift. The benefits, however, are pretty substantial. So in patients who have a very lax neck, this is really the gold standard for rejuvenating significant laxity of the neck skin. In addition to the platysmoplasty that we perform in the midline, this skin elevation posteriorly that we do up into the occipital hairline allows us to have substantial removal of excess skin. And so I think it's a great procedure in people who need that. I think one of the biggest differences between a short incision lift and a long incision lift is the extension of the incision back into the occipital hairline. In patients who want to wear a ponytail, I think sometimes the incision that goes back into the hair can be visible when they're wearing a ponytail. It's a trade-off. If a patient's priority really is to tighten the neck, and if they have substantial looseness of the neck skin and the muscles of the neck, I think a full long incision facelift is appropriate. If they really can't tolerate the fact that they're going to have a scar there and they really want to wear a ponytail, then they can elect to have a short incision lift, as long as they're aware that it probably won't tighten the neck as much. So who's a candidate for a long incision lift? As I've mentioned before, someone with very prominent jowls, laxity of the jawline, marionette lines, and a very poor neck angle because of substantial loose skin. I think in those patients, the results are best if we can really pull that extra skin backwards into the hairline. So here's an example of a long incision facelift in terms of the incisions and the flaps. So the incisions are very similar to the short incision lift, except that we're going to extend the incision into the occipital hairline. This allows for elevation of skin all the way down here and then all the way into the front of the neck. So it also gives us a little bit more access to the SMAS layer, so we can pull more of the SMAS posteriorly and superiorly. And this is that incision line here that, of course, in a patient who's wearing a ponytail, they might be able to see that. So the steps of the long incision facelift are marking and making of the incisions. I always will perform a platysmoplasty with this type of surgery to really tighten the neck in the midline before I pull it laterally. The skin is elevated so that I can access the SMAS. The SMAS is either removed partially or folded onto itself, depending on whether a patient has a full face or a thinning face. And once that's done, the skin is redraped and trimmed, so the extra skin is removed, and then the skin is closed with staples and sutures. Once the long incision facelift flap has been elevated, it exposes the SMAS layer. So the SMAS is again in yellow, and that's marked. Sometimes it's cut, and sometimes it's folded onto itself. When it's cut, that section of the SMAS is removed, and then the anterior portion of the incision is pulled backwards and upwards to close that defect and subsequently pull the jowl and the neck. So that's pulled in an upward direction and sutured in place. So the risks in recovery with long incision facelift, again, probably the risks are slightly increased bleeding and infection, as well as poor wound healing. The risk of hematoma is elevated with a longer incision. The more skin you elevate, the better the results, but the higher the chance of things like hematomas or significant bruising. The recovery time from long scar facelift, again, depends on the person, but because there's more skin elevated and more platysma tightened, usually the recovery is longer. I often tell people that they should have 2 or 3 weeks off of work after a surgical procedure like this. When talking about the risk-reward trade-off with a long incision facelift, again, the risks are increased of bruising and swelling, the recovery period is longer, the rate of hematoma is slightly higher, but in terms of improvement, this is the procedure that gives the most substantial improvement to the neckline and the jawline. And in patients who are requesting a substantial removal of skin or substantial tightening along the jaw and neck, this is usually the procedure of choice.